When a child presents with diarrhea, there are a number of causes that come to mind. It's only through a systematic approach that you will reach the correct conclusion in most cases. You'll now see how the IMCI guidelines provide the tools for you to classify this common condition.
Diarrhea occurs when stools contain more water than normal. Diarrhea is also called loose or watery stools. It is common in children, especially those between 6 months and 2 years of age. It is more common in babies under 6 months who are drinking cow's milk or infant feeding formulas. Frequent passing of normal stools is not diarrhea. The number of stools normally passed in a day varies with the diet and the age of the child. In many regions, diarrhea is defined as 3 or more loose or watery stools in a 24-hour period. Babies who are exclusively breastfed often have stools that are soft. This is not diarrhea. The mother of a breastfed baby can recognize diarrhea because the consistency or frequency of the stools is different than normal. What are the types of diarrhea? Most diarrheas which cause dehydration are loose or watery. Cholera is one example of loose or watery diarrhea. Only a small proportion of all loose or watery diarrheas are due to cholera. If an episode of diarrhea lasts less than 14 days, it is acute diarrhea. Acute watery diarrhea causes dehydration and contributes to malnutrition. The death of a child with acute diarrhea is usually due to dehydration. If the diarrhea lasts 14 days or more, it is persistent diarrhea. Up to 20% of episodes of diarrhea become persistent. Persistent diarrhea often causes nutritional problems and contributes to deaths in children. Diarrhea with blood in the stool, with or without mucus, is called dysentery. The most common cause of dysentery is Shingilla bacteria. Amoebic dysentery is not common in young children. A child may have both watery diarrhea and dysentery. A child with diarrhea is assessed for how long the child has had diarrhea, blood in the stool to determine if the child has dysentery, and for signs of dehydration. If the child has diarrhea, ask for how long. Diarrhea which lasts 14 days or more is persistent diarrhea. The health worker should give the mother time to answer the question. She may need time to recall the exact number of days. Ask the mother if she has seen blood in the stools at any time during the episodes of diarrhea. Then the health worker checks for signs of dehydration. When a child becomes dehydrated, he is at first restless and irritable. If dehydration continues, the child becomes lethargic or unconscious. As the child's body loses fluids, the eyes may look sunken. When pinched, the skin will go back slowly or very slowly. There are 3 classification tables for classifying diarrhea. All children with diarrhea are classified for dehydration. If the child has had diarrhea for 14 days or more, classify the child for persistent diarrhea. And if the child has blood in the stool, classify the child for dysentery. There are 3 possible classifications of dehydration in a child with diarrhea: severe dehydration, some dehydration, no dehydration. After the health worker has classified the child's dehydration, he classifies the child for persistent diarrhea if the child has had diarrhea for 14 days or more. There are 2 classifications for persistent diarrhea: severe persistent diarrhea and persistent diarrhea. If a child has had diarrhea for 14 days or more and also has some or severe dehydration, the health worker classifies the child's illness as severe persistent diarrhea. A child who has had diarrhea for 14 days or more and who has no signs of dehydration is classified as having persistent diarrhea. There is only one classification for dysentery, that is dysentery.